Hello friends, Happy New Year to all of you. Dr. Parimala Devi here. Today I'm here just to make it more clear to my women friends who are very much concerned about one condition in their health part of the life, that is fibroid uterus. What is this fibroid uterus? Why are we so much concerned as women regarding this fibroid uterus? Is because it is so common. It is seen almost as much as 25 to 30% of the incidence of the fibroid is there, and it can be seen from the as young age as about 20-22 years to 50-55 years also. What is the problem if the fibroid uterus is there? Why are we so much concerned? Because it has got a lot of implications on a girl who is having fibroid, starting from heavy bleeding to not giving any scope to have the pregnancy. That is, they will get into infertility and pain abdomen most of the time because of the tumors which are situated in the garbhada chila, that is uterus, and also in the elderly age group when they are about to stop their menstruation, these fibroids may trouble them. So because of this fibroid uterus, which is as much as 30 to 50% of the incidence in our women, should be taken care in a very meticulous way and by experienced clinicians. What is the very important point I want to highlight is there are a lot of myths about fibroid, that fibroids are not usually one in number, they are in multiple. Of course, it is not a myth, it is the fact actually. Sometimes they are only single fibroid, or there can be as much as about 40, 60, 100 fibroids, also small fibroids like pebbles studded by the uterus. The fibroids are one which will usually bring the woman with pain abdomen, or she may come with a lot of heaviness in the pelvis, or she may come with menorrhagia because there are fibroids are increasing the menstruation surface of the endometrium. And also it may come to a situation that she wants to go for her family, she want to get a child, but her condition of fibroid present may not allow her to get into pregnancy because it may cause abortion, or it may act as a contraception because it is within the cavity of the uterus, or it may be having the pressure symptoms and it will give rise to lot of discomfort for the woman even during the sexual act. So other than this, in elderly women, when the woman is about to stop menstruation, fibroid uterus, if they are there, they may not allow the woman to attain the menopause at the right time, that is about 51 years. And also they may be so big that it may come in the way of their bladder evacuation, that is urination, or pressing on the bladder and giving rise to dysuria. And also it may get converted to a emergency because sometimes it can press on the ureters which are going from the kidney to the bladder, and they may cause that hydronephrosis condition also. So like this, fibroid has got its implications in the woman life one or the other way. Is it then, how do we treat these fibroids? What are the myths? So as I said, fibroids can be one also, fibroids can be many in number, but they are all going to cause menorrhagia. It is wrong, because where the fibroids are situated, whether they are situated within the cavity of the uterus, or they are situated on the surface of the uterus, or whether they are in the within the muscle fiber of the uterus, intramural we say. These are the positions, and how many numbers are there, what is the size of the fibroid, whether they are near the mouth of the uterus where the semen will enter and help the woman to get into pregnancy. All this individualization of the point should be done when a woman comes to you, and there is no rush up to do the surgery, and women need not get scared about it. Surgery is sometimes really indicated if the fibroid is very much situated within the cavity, that is what we call it as endometrial fibroid within the cavity, and it will make like a polyp and make the woman to bleed continuously, and it will make her very sick. That time immediately we may have to remove it as a polypectomy or removal of the necrotic fibroid. Sometimes it may pop out of the cervix, uterine mouth, and when we examine the woman, we may see it that is the cause for her problem, and it may act as a obstacle for the not getting into pregnancy because of the improper sexual activity. And also, if the fibroids are very big and pressing on the ureter and causing the hydronephrosis and compromising the kidney health, then also they are emergency. And sometimes when they are so big that it has got lot of pressure symptoms as big as up to the episternum or the chest, I can say. We have seen fibroids of about 8.5, 9 months of pregnancy size abdomen, and sometimes very innocently some women will not even know that they think that they have just put on weight, so their abdomen has become big. So in all these conditions you may have to be very alert and aggressively doing the surgery and helping the woman to get into her good health. So like this, fibroids are treated mainly for their symptoms, and also there are some tablets which have come to the market, but we have not found much good results with them. And there are what is called as uterine artery embolization has been tried in some cases. From there the uterine artery vessels are necrosed, and the blood supply is cut off and fibroids can shrink in size, but still studies are going on the effect of these uterine artery embolization procedures. And also it can be treated by what is called as HIFU. But whatever said and done, but surgery, that is myomectomy, removal of the fibroid, is the treatment when it is really giving a lot of health problems to the woman. So, and another myth that a girl or a woman with fibroid uterus will never conceive. No, it is absolutely wrong. If the fibroids are just on the surface, if they are small, there is no point in worrying. They can definitely get a normal pregnancy. Many a times we allow them to get pregnancy, then we usually go for the surgery. Doesn't mean that we have to do surgery and they have to get pregnant, but I'm telling you again and again, each case is to be individualized clinically, and we have to take the decision. The same rules doesn't apply to all the patients, because each patient may have different type of fibroids along with the different numbers and the size. So individualization of the patient is very important. And also when there are problems, please approach your doctor. Try to understand more about fibroid. And the last myth that fibroids are going to be cancerous in the later age group. No, the luckily the conversion rate of fibroids themselves going for cancer is very less. That is 0.2%. Even in my lifetime experience of these 35 years, I have not much seen. Only one patient I have seen of a fibroid getting into uterine sarcoma. Otherwise it's very less. And the fibroids, even though they are troubling our women, but they are very good in not getting into any cancers. So I would appeal to my friends, women here, that you don't get so much of anxiety just because you have a fibroid. Get a proper counseling and discussion with your gynecologist whom you know, and also try to understand your requirement, your symptom. What is your this one? You have pain just during the menstruation, you can be treated with the tablets also. You want to have a baby, then you get treated in its own way depending on your fibroid size. And also if it is a big fibroid, then don't hesitate, immediately listen to your doctor and get operated. Like this, fibroid can be treated in all ways, and we can give you the best of the best health. And I want you to understand and go ahead and not into unnecessarily anxiety and unnecessary myths about fibroid uterus. And let us all unite and try for the best of the health of the woman. And thank you once again, and happy new year. Be safe and take care of yourself with all the safety measures of using mask and social distancing, everything, because this is a pandemic time. And let's all have our best and best time without getting into any problem of COVID. Thank you so much.